Thanks for coming in today. I think you're here to talk to me about some information I sent you through the post to do with...
I'm really sorry, I didn't bring it with me, I forgot.
Oh, it's okay, we've got everything
right?
here. Yeah, that's fine, yeah. So do you want to start by telling me what you made of it?
It made me worry. I realised that, you know, that the whole point of that was that potentially I might be likely to have a stroke. Okay. My father had a stroke, which is very upsetting, you know, family thing and might run in the family. So, yeah, it's made me worry and wonder.
What I'd like to do today is talk to you about what your options are.
Yeah.
And I think you've probably got two main choices. One is whether or not you want to take a medicine that can reduce your chance of having a stroke.
Right.
And then if you do, your second choice is what medicine that might be. So the first thing to point out is that you've changed since you first got your diagnosis of irregular heartbeat.
Right.
You've got older and your blood pressure is now high where it was normal before.
Yeah, being put on medication.
Yeah, and those two things have really changed the risks that you have of having a stroke and the benefits that you could get from medicine.
I see.
So it's not necessarily that it was missed before, it's just that things have changed. So the first thing to check with you is, since I sent that information, that nothing has changed, that your risks are still as they were, so we're having the right conversation. So could you just take a look at this list of risks here for me and tell me, so I think we had given you 1 point because you have high blood pressure.
Yes.
And you're female, so it's 1 point. And your age between 65 and 74.
Yes.
Has anything else changed?
No.
So that gives you a total score of 3.
Right.
Which is the same as it was before. And essentially what that means, John, I know you've seen this as part of the information that was sent out, but because your dad had a stroke and it's so emotional for you, I just want to make sure that those emotions are not clouding your decision. I want to show you the risks in picture form so that you can...
I don't think they are, but
okay,
you know, we'll
great,
see. Yeah.
Good. So for somebody with the same score that you have, and these are not perfect by any means, if 1,000 people were to go on for a year with atrial fibrillation, then 37 of them would have a stroke during that year.
Okay.
So it's by no means certain that you would have a stroke, but that is the same risk every year, so that's a cumulative risk, we call it. So the more years you have atrial fibrillation for, the higher your risk gets. Right. If we were to give all those 1,000 people a medicine that stops your blood clotting easily, we'll reduce that number of people who have a stroke from 37 down to 12. So those people would have had a stroke prevented. The problem with these diagrams is I don't know whether you're a green face, a yellow face or a red face. No. And you could go on and take...
these people.
Yes, exactly. That Miss Average doesn't exist. Yeah. So, you know, you could take a medicine and it not have reduced your chance of stroke. You don't have a stroke, but you wouldn't have had one. No. Or you can take this medicine and still have a stroke, and that was just what was destined for you.
But the odds are better.
They are definitely better, yeah.
You're talking about blood thinners. Are you talking about warfarin?
Oh yes, do you know much about warfarin, Joan?
Well, my husband had a blood clot in his leg a number of years ago now, and he was given warfarin for a few weeks, and it worked. He seemed to be fine after that.
Yeah, great. So warfarin is one of the options, but there are also 4 other medicines that you could take. Okay. So we'll come on to those in a little while.
Right.
Yeah. Looking at those diagrams here, have you got a feeling for whether or not you'd like to try an anticoagulant, Joan?
I'd already thought about it before I came, and you know, because of all the information you're giving me, and the way I feel about it now, that it would just be common sense for me to go on it. Yes. Okay. Yes, I would.
Okay, great. So the other thing then to talk about, the other side of that coin, is that all medicines have side effects. And when you're taking an anticoagulant that thins your blood, obviously the major side effect is bleeding. And that might be from your nose, or if you cut yourself, it would bleed for longer and eventually stop, hopefully. If it didn't, you would come to A&E. But the bleeds that people really worry about are big bleeds from your tummy that might mean you need to come into hospital for a blood transfusion, or a bleed into your brain, which is very like a stroke. And so these, because you don't have really very high risks of having a bleed, if you don't take an anticoagulant for the next year, and 1,000 people like you did that, then 3 of those 1,000 would have a big bleed like this anyway. And a lot of that risk is because you've got high blood pressure. Right. And if you take an anticoagulant, if those 1,000 people took an anticoagulant, an extra 4 people would have a big bleed. So that's gone from 3 in 1,000 to 7 in 1,000, which is more than doubled. How do you feel about those numbers?
I'm not quite sure how I feel about it, really. Just thinking about the whole picture, I still think I would like to go ahead and take
Okay.
something.
Okay,
Yeah.
great. So are you happy for us now to move on to talk about what the options are?
Yeah, I mean, I didn't know there were others, if you know what I mean.
Yes, yes. So I suppose you came in here thinking that you might
Yeah,
be going
well,
out with warfarin.
yeah, yeah.
And how did you feel about that?
Well, it worked fine for my husband. I think I feel okay about it. But then, as I said, I wasn't aware that there were alternatives.
So there's 4 alternatives, and although they're broadly similar in the way they reduce your risk of stroke, they have got differences between them. And there's a lot of information in that brochure I sent you, so it doesn't surprise me that it didn't all go
I
in.
found all that
A bit too much.
Yeah, just a bit
Fine.
too much. Yeah.
So what I'd like to do is ask you about the things that are important to you, and then I can narrow down your options. And if there's more than one option left, then I can help you to make
Okay,
that choice, or you can tell me what you need to do to make that choice. So is it important? How important is it to you? How often you have to take medicines during the day?
I haven't even really thought about that, but
So at the moment you just take 1 tablet in the morning.
I take
is
one
that
tablet
right?
in the morning for my high blood
Mm-hmm.
pressure.
How would you feel about taking a medicine twice a day?
I think I would prefer it. If there is an alternative that's once a day, yes, I think I would prefer that, because I'm into the routine of taking my medication, and I think it would be safer, it'd be less likely to forget, to
Okay,
take the
to take
second
them
one if there was
together.
another one later in the day.
Okay, so
Yeah.
that's quite important. So I'm just going to make some notes on this one and get rid temporarily of the ones which are twice a day. What about having regular blood tests, Joan? So you knew that warfarin, I think,
Yeah, because
needed
he
blood
had
tests
to-
because your
he had to go
husband had
quite
to.
regularly,
And how important is it to you to have or avoid those?
If I had to have them, would I have them at the surgery here?
We do have a clinic at the surgery here, yes, once a week on a Thursday
Yeah.
morning.
Um,
But some of these medicines you don't need blood tests done so often. It might just be once a year or so.
okay. I'm a bit ambivalent about that.
Okay.
Yeah.
And what about having to change what you eat or drink? And I'm thinking particularly about cranberry juice, grapefruit juice.
Oh, I saw that, but no, I've never liked them, so
It doesn't bother you
that
too
just makes
much,
no
your
difference
diet.
to me. No.
And what about alcohol intake? Joan, do you take much alcohol?
Not a huge amount. No, not much at all, really. I have special occasions, that's all.
Okay. And what about food that have a lot of vitamin K in, like kale and broccoli and
Oh, right.
winter cabbages, that kind of thing? Do you love those? Or
I could do without them, I suppose.
Okay,
Yeah, I mean, I don't eat much kale. I don't really fancy it that much, but broccoli, I eat quite a lot of broccoli.
And I know
But-
that you take, I know that you take a medicine for your heart rate. Do you buy any other medicines or remedies?
No.
No, nothing. Okay. How important is it for you to have something that could be reversed if there was an emergency? So say if you're in an accident, some of these medicines are reversible and some of them are not.
Yes.
How much of a concern is that?
I read that quite carefully, actually, and I think I would like it to be reversed, be able to be
Okay.
reversed pretty quickly.
Okay.
Yes, I find that kind of frightening.
Yeah,
Yes.
fine. So of the newer ones, there are antidotes in development for the ones which don't already have one, and they're likely to be on the market in the next year or two. Does that sway your decision, or would you want to feel safe from day one?
I would. That was one of the things that I felt was most important to me.
Yeah. Okay. Right. Grand. Very important. Well, I think that narrows your options down, Joan. So I think we've excluded all of the newer ones,
Right.
which are either more than once a day or have no antidote. And those are the things which are most important to you, aren't they?
Yes.
So I think it does leave us with warfarin
With
as the option which is
Just one I was
fitting.
thinking about in the beginning.
Yeah,
Mm.
fitting best to the things that are important to you. Yeah. How do you feel about that?
I think I feel okay. I think I would like to go ahead.
Okay.
I'd like to know a bit more about what it involves, but certainly.
Grand.
Yeah.
So you don't have to make a decision today. So although we're talking about risk of stroke,
Yeah.
it's not urgent that we do something today, right now.
No.
You can have some more time to think if you want. But
I'm not sure I do.
okay.
No.
So why don't I tell
would
you?
like to go ahead. I mean,
Fine.
what do we do now? How
Fine.
does this work?
So how we would proceed is I'll give you a yellow book which has got some more information in about warfarin and a monitoring record for you to hold. I imagine your husband had one.
Yes, he did.
And then you bring it with you to the surgery. I'll take some blood today and we'll check how your blood is clotting now.
Right.
And I'll give you a prescription as well for your warfarin. And then when that blood test comes back in a couple of days, I'll give you a ring and I'll tell you whether or not we want you to start taking your warfarin. Just be 1 milligram, just 1 brown tablet once a day for a week, and then we'll bring you back next week to have your blood test.